Frederic, what are the key topics at Med-e-Tel 2015?
As always, the Med-e-Tel conference program has quite a varied program. Some of the highlights of this year's event are around interoperability of mHealth and eHealth systems, around smart technologies for independent living and aging well, around women in eHealth and how they can advance education around those topics, and a varied amount of other topics as well.
So how many delegates have you had coming here from which fields?
Yes, overall there are more than 350 participants coming from industry, coming from healthcare, and within healthcare as medical doctors, as nurses, as social workers even, also researchers who are active in the field of telemedicine and e-health, and policymakers on a local, regional and national level.
Tying in with that special topic of interoperability, you've had a dedicated event conjointly happening here?
Yes, indeed. The IHE Europe Connectathon is taking place at the same time, bringing together over 350 technicians who test health IT systems interoperability.
What have participants that you spoke with told you about their impression of this year's event?
On the one hand, participants very much appreciate the varied and extensive content of the conference program that they have here, and where they can pick from the conference program those presentations and sessions that are of interest to them. And on the other hand, of course, the networking aspect of the event, being able to exchange experiences and knowledge with participants coming from other fields and other professions, is very much appreciated by all attendees.
What are your plans for next year?
Next year we will be back here in Luxembourg on April the 6th to the 8th. We will obviously start working on the next edition as soon as this one finishes, and we are looking forward to working together again with many of the partners that we have at this year's event as well.